Hello, everyone. Welcome, and thank you for attending today's webinar, Optimizing Your Field Team to Maximize Patient Access, presented by Phil Incorporated. My name is Joan Wiseman, and I'll be moderating this webinar. We have some outstanding speakers for you today, who we will meet in a moment. You can read their full bios on the left side of your window by selecting the Speakers tab. Before we dive in, a couple notes. You can access additional resources for today's presentation by clicking the Handouts tab on the left side of your screen. If you would like closed captions, those are available from the bottom right corner of your video player. This webinar is being recorded, and it will be available to watch on demand within 24 hours. We would love to hear from you. If you have a question at any point during the presentation, submit it using the Q&A tab on the left side of your screen, and then time permitting, we will conclude with the Q&A session and cover as many as we can. All right, starting us off today and introducing the other speaker is Catherine Wood-Hill, who is the VP of Marketing for Phil Incorporated. Catherine, please go ahead.
Hi, thank you. It's great to be here. I want to first introduce myself. Like Joan said, my name is Catherine Woodhill. I lead marketing for Phil. I have almost 20 years of marketing experience working in both business to business and really consumer facing technology companies. And really what the kind of theme that runs through all of the companies that I work with is a real focus on creating excellent experiences for end users, be it patients, be it customers, or the businesses that we're working with. And one of the things that I'm really passionate about working with Phil. Today, I am joined by Julia. Julia, I'll let you introduce yourself.
Thanks, Catherine. My name is Julia Murphy, and I am Vice President of Patient Services with Real Endpoints. Like Catherine, I've been in the business for 20 years. Most of my experience has been on the vendor side, so it's companies like Parexel, UBC, Occam Health. Also spent some time on the manufacturer side with Spiro Therapeutics, and now I am part of a boutique market access consulting firm, Real Endpoints. So thanks so much for inviting me today.
Great, we're happy to have you. I just want to quickly touch base on our agenda for today and the takeaways that we hope you will leave with. So starting with, we're going to talk about some quick research findings and industry trends. Moving on to really key strategies for optimizing the field team. And that's where we'll spend the bulk of our time today. We have a quick case study, and then we will be taking questions and answers. Throughout the session, if you have questions, you can always put them into the Q&A box, and we'll try to address them as we go. Otherwise, we will make sure to get to as many of them as we can at the end. Today, we really hope that you walk away with an understanding of why the traditional sales model should evolve to focus on improving coverage and adoption, and a focus on your preferred channel. Really how to optimize your field teams in order to unlock coverage through effective training, incentive alignment, and the right tools to promote behaviors that really improve outcomes for patients, for your HCPs, and for your brands. And then, the criticality of a data-driven approach that equips field teams with real-time insights on the prescription journey and how those insights can really help you to monitor and optimize your programs, even down to the territory and HCP level. And then how, some real-world success stories and what, real manufacturers are doing in terms of utilizing these tactics in order to improve the success and outcomes of their field teams, but most importantly, improving patient access and manufacturer gross to net. All right. Julia, if you want to go ahead and kick us off.
Sure. So the current state of access and affordability, in that we have 3 in 4 patients who try to fill a new prescription were unsuccessful due to utilization management. And so those types of things that prevent an immediate fill are step therapy requirements or prior authorization requirements. And as we all know, when a patient presents to fill a script, if it's not filled immediately, the likelihood that it gets filled at all decreases significantly. And so putting methods into place and having patient access support tools so that patients understand what the steps are and how to optimize getting their fill is really important. And so making sure that the field team is aligned with all the tools that are available, shares that with the HCP offices and the patient, really helps to increase that fill rate. We also know that 79% of practices report that the PA requirements are increasing. Though we have seen a couple of insurance companies really focusing on trying to rein in prior authorization, it still is a huge part of utilization management and is the biggest tool that payers use to try to control cost.
Right.
And there is a predicted increase in pharmaceutical sales roles over 2021 to 2023. So even though access was restricted during that time to offices, there has been an increased need for field roles, whether they be live or part of a remote access and being able to connect with offices in a more digital way.
So I think that that does a good job of setting up kind of some of the challenges that we have seen with a traditional field model. As you're getting that restricted access due to COVID, as well as increased utilization management challenges. A lot of the things that we were doing in the traditional field model are just no longer working. And that traditional model really was relying on those in person meetings. And then, if there is a hub with really phone based interaction, so a lot of outbound calls to patients. And a really paper driven kind of old school way of interacting with access tools. So, big, heavy paper forms and a reliance on the HCPs to do a lot of that administrative work in order to drive access for patients. There were a lot of just printed resources that were offered to providers that got lost on someone's desk and never actually made it to the intended target, as well as a really limited focus on the patient journey and patient outcomes. It was really focused on getting that initial script written, with a lot of kind of limited focus on how to actually pull that script through and make sure that the patient is actually getting started on that therapy, and that they're getting the outcomes that they need. And it was really just restricted by outdated data for decision making. So if, as a brand, you are getting that data from your access partners and from the pharmacies, traditionally it is very delayed. You're waiting 6 weeks for that data to come back to you, and have a big data team that's trying to stitch all of that information in order to draw conclusions about what's happening out there in the field. But by the time you get that data and stitch it all together, things have changed, and it's really difficult to actually, make informed decisions based on that data. So, Julia, I think that everything that we've talked about so far shows a really challenging environment for field teams. From your perspective, what has this looked like?
In a traditional model, it's been a challenge for sales reps, right? So we have so many products that have so many different requirements. Traditionally, it was a sales rep that was very knowledgeable and clinical, and that was their focus. Now they need to be experts in reimbursement, or have a field reimbursement rep as a colleague to help them work through those requirements with the offices, because so much of the sale then becomes access, right? So obviously, clinical selling is the key for traditional reps, but then addressing the access and having the patient be able to fill the script and take the medication becomes more important. So offices now, with the change, especially with COVID, they're looking for multi-channel experiences for their patients and themselves. So there had been a lot of reliance on portals. Offices are tending to be more open to using portals and being able to monitor as long as the data that's there is accurate and timely. So that real time data from your access partners is really critical. And then patients, they are, all of us are used to having an Amazon model, right? Being able to order something and have it come the next day and being able to access through your phone. And so having those channels available are just really going to increase the interaction and responsiveness of the patient. So those digital assets are critical. The extensive education is necessary. So, having the tools available, but also educating both your field and their offices on what the tools are and what's available to them, so that they know how to use the tools correctly and know where to look if there is a roadblock that's experienced, and just focusing on that interconnected patient experience so that from a patient's perspective it's seamless, but behind the scenes we know that there are API connections or different things that are happening in the background that ideally patient is never aware of, but that just smooths the experience so that even if the patient is interacting with, say, the hub and then the pharmacy, that they don't really realize there's a difference. To them, it's just one entity. And then, having the ability to have the field teams relying on real time data is just really critical. So, there are metrics that need to be monitored to make sure that your field team is effective. And having that real time access is the way to see what's happening in real time instead of waiting a week or multiple weeks to be able to see what's happening when you're making adjustments to business critical decisions.
Yeah, you touched on a couple of really important things there. And I think, one of the things that is kind of underpinning all of this modern experience is, the patient experience and the consumerization of that experience, and how every piece of this, from the way that the brand reacts to the way that information is delivered to the way that an HCP is receiving and giving data, I think, underpinning that with kind of a consumer experience and really understanding the fact that patients are dealing with Amazon and DoorDash and Uber every day, and that the consumer experience for healthcare has been really kind of delayed in terms of adapting to these new experiences, and that today it's becoming unacceptable to have that more traditional model where you are not meeting patients and HCPs right where they are and providing them with choice in how to best access and receive care.
Yeah, absolutely. And I do think, if there is a positive at all to the pandemic, it was kind of pushing healthcare to become more accessible, like retail, because of the challenges of people being able to meet in person. And so that's one of the things that's actually uh, gone well coming out of the pandemic.
Yep, absolutely. So moving on, I think, we now have an understanding of where we were and kind of that forcing function that has happened in order to move brands towards, a more modern experience for their patients and HCPs. But I think for a lot of brands right now, particularly ones who have been in the market for, a little while, it is difficult to start to make that change and to understand how to really start to create that experience for their patients and HCPs. And I think that there are a few key ways that brands can work with their field teams in order to really optimize that experience and optimize the number of patients who are getting on therapy, but also the experience that their HCPs are having with the brand. Um, So I think, starting with having an awesome team and hiring the right people who are going to be able to have those more complex conversations with their offices and really, not only kind of sell the science of the drug, but also be able to understand the pains that their HCPs are facing and help to, support them through the access journey as well. But once you start with that great team, there are a few strategies that you really need to employ in order to optimize them. Starting with proper education and really making sure that you are enabling those field teams, whether it is sales reps or FRMs who are in the field, making sure that they have the tools that they need to be able to have good conversations.
Yeah,
I think it's also
absolutely. Part of the educating the team is making sure that the patient access strategy that has been determined for launch, that that's shared and understood across stakeholders, and so that your sales team and your field team, that they're saying the same things, and that your hub partner and your pharmacies are saying the same type of messaging.
yeah, I think
The
it's a
worst
really
thing
great
is to yeah.
that you're not just educating your sales reps. When we talk about field teams, we're not just talking about sales reps. We're also talking about, your FRMs and your hub partners and everybody who is involved in getting HCPs and patients aligned in order to drive access.
Yeah, absolutely. And kind of moving on to the next, that taking the integrated approach, it's really, especially when you have a sales team and an FRM team and a hub, making sure that those teams know how to work well together. So understanding the types of situations that they're going to be presented with and really thinking through, okay, if this happens, who's the person who should kind of take it and own it? When do I hand off to the next person? What types of things am I allowed to talk to the hub about? Which role is able to talk about more in detailed situations that might come up with the HCP? So really thinking through what those scenarios might be and making sure that everyone understands their role and can work well together.
Yep. And next, I think it's really, leveraging that real time data. So being able to make decisions on a territory level, on a payer level, and on a even individual HCP or practice level to be able to optimize access for patients in real time is something that's going to be critical, and we'll talk through in more detail. And then finally, we'll talk through how to best align incentives. And this isn't just, talking about IC, but talking about incentives across the entire ecosystem in order to make sure that we are, driving the best access and the most effective programs possible. All right, so starting with educating our field team. There are, a couple of components that we've talked about already. I'm just going to introduce them and then let Julia dig in a little bit more detail. But first, I think, Julia mentioned really helping to understand the overall strategic objectives of the brand and making sure that everyone throughout that access journey understands what those strategic priorities are, so that everybody's coming from the same place. Oftentimes I will talk to clients where the sales reps are comped on one thing, but the goal of the brand is something else, and you will wind up with those, misaligned incentives that wind up driving a disconnected experience, and potentially driving down the gross to net and the viability of the brand overall. Additionally, I think that it is, syncing with the field team and the leadership stakeholders and making sure that all of them are in alignment and kind of, speaking from the same place. And then finally, equipping that team with the right messages and materials for HCPs and patients, and being really prescriptive about understanding the challenges that each of those audiences are facing and how to create the right materials to best support them. Julia, is there anything you wanted to dig into here in terms of educating your field team?
Yeah, I would just say that, when you are a new brand, so for example, a new brand getting ready to launch, the goals and objectives over that first year change. So when you are immediately launching, you may not have payer policies in place. And so making sure the field team has messaging that surrounds that, and what is your plan to be able to get coverage. They have to be able to express that to HCPs to gain their confidence. And your patient access support team, there may be tools that you're using in order to facilitate access at the beginning, things like free trial offers, but understanding that how those are going to ramp up or ramp down as things change over that first year. So you really have to plan for the change and make sure that everyone understands the objectives for the change, what the indicators for turning things on and off will be, and being able to express that to offices so that they don't expect to get free product for a year. Those kind of things to be able to educate the team and equip them with the right messaging is really critical from launch and go live.
Yeah, and I think that the other piece here that we have not, explicitly lined out is, as a brand, having a perspective on what channel should be used in certain circumstances. So that the field team is equipped with the materials and the kind of process in order to get patients on therapy. A lot of times, if there is a hub, it's sort of a secondary or tertiary option, where particularly with branded retail drugs, where they are available at retail, just difficult to actually get paid for or at an affordable price, or where the risk of being swapped out for an alternative drug is very high. The importance of educating the field team on how to help support patients getting on therapy is critical. And so, as a brand, providing those more prescriptive materials in order to help to support prescribers in getting their patients on drugs, I think is really critical, and is something that needs to be part of that training process.
Yeah, absolutely.
All right, so moving on. Next, Julia, I'll let you dive into this one.
Okay, great. And we did touch on this briefly, but taking that integrated approach. So developing the overarching success criteria, right? So thinking about, before you go live, what are the things that are meaningful to us as an organization, and what does good look like, what does bad look like, and preparing for both. Being able to set up the system so that you can monitor performance, and so that you can easily see when things are going well and where things need to be tweaked. Because any program that's designed, patient support program specifically, should be a live thing that changes over time, right? And so you should constantly be monitoring and making tweaks and make it better for both the patients and the HCPs over time. And really creating a feedback loop for the field team and the HCPs that is real time, or as near real time as possible. So figuring out what those items are that are actionable, and letting the field team, the person who can actually influence that, let them know in a timely manner so that they can follow up and can keep things flowing, so that things don't just become a roadblock. So things as simple as, I have a doctor who keeps forgetting to fill out this one piece on the enrollment form. Having the ability for that field person to see if there's missing information. What is that missing information? Is it happening repeatedly? What can I do as a salesperson to go in to help that office to prevent that moving forward? And so those things that might seem small, but really create a lot of time and frustration, especially for the patient.
Yeah, I think that feedback loop is really important. And, the example that you just touched on, right? You're going to help to pull through that individual patient, right? That you are following up on based on real-time data that you provided to the FRM. But then you're also going to be able to take that step back and train that HCP and help them to understand how to, best get more of their patients onto the therapy using that data. I think that's a great call out. So next, I know these two are really kind of interconnected, but do you want to just dive into leveraging that real-time data in a little bit more detail?
Sure, absolutely. And so, we talked about ways to leverage some real-time data, but really ahead of time, identifying some key data points that are going to help you gauge the field team's effectiveness. So, are you looking at things like a number of enrollments that you're trying to drive? Is there a different key indicator? Are there certain key practices that you'd like the field to engage with? And so, as you see them start to send in enrollments, making sure that everyone knows and can see that the team is really engaging those prescribers that you're targeting. Um, Creating a responsive data model with key requirements and regulations. So, making sure that the data is being shared appropriately and that the right people are getting the right data at the right time. And then, building field team portals and offering real-time actionable insights. So, a lot of times manufacturers are doing this in twofold way. Field teams are out there and they're in their cars. They're um, going to different practices, and so their ability to log into portals can be limited to certain times during the day. So making those tools available through a phone, something that's easily can be read, and they can easily find the information that they need in those portals quickly. But also sometimes providing those in real time. So having notifications so that pieces that are important to your organization, like a new enrollment coming in from a new HCP, giving them the ability to get that notification in real time so that they can reach out and say, hey, doctor, I see that you've submitted an enrollment. I'm going to keep monitoring and make sure your patient gets service all the way through to fill. So being able to have that kind of real time access to data is critical and helps them to be more effective.
Yeah. And to kind of second what you were saying on that first point, which is identifying key data points to gauge your field team's effectiveness, I think this is where a partner who has really robust data can come in really handy. So from an access perspective, if you can look at, the total number of new prescriptions coming in and then understand, okay, of those NRX, how many actually enrolled in the program? How many from enrollment to, the prior authorization actually being submitted made it through, and looking at that funnel all the way through to dispense, and not only dispense but through refill as well, to understand that individual behavior all the way through in order to make pinpointed educational decisions and to potentially as well optimize your program from a business rules perspective as you are looking at each of those pieces of the funnel can really help to improve your pull-through rates and ensure that as many patients as possible are getting on therapy. I think that real-time data can help to, one, empower that one individual field rep or the one individual FRM, but also to take a step back and inform from a program-wide perspective how to best optimize.
Yeah, I agree. And it's also not always just program wise, but expanding that out a little bit at the manufacturer and adding in the payer team, right? So
Yeah.
having them have the ability to see how are payers reacting and what are they actually doing. Like they may have said, we're going to approve this with, a PA with certain requirements and and certain limitations, but is that what's really happening? And so in a kind of real-time basis, see what the payers are actually doing. So the data really goes beyond just the patient access team, but to the larger organization and goes into, contracting decisions with payers. And there's just so many uses for the actual real-time data that's collected.
Yeah, absolutely. And then next, I think that also this is an extension of that data piece as well. It's really how do you align incentives in order to drive brand and patient outcomes. So starting with, analyzing your current filled incentive model, it's important to understand, is that plan that you have in place actually driving to the business objectives and to the access objectives? So while traditionally you may comp on NRX, potentially it may make sense to, based on what it is that you're trying to do from a brand perspective, it may make sense to comp on covered prescriptions, or it may make sense to comp on, total months, so TMOT as opposed to NRX, and really thinking through what it is that's going to drive, one, the best patient outcomes, two, the best experience for your HCPs, and three, improve the gross to net of your organization by incenting the behavior that's going to be positive for all stakeholders involved. With that, I think that you also just want to think through, once you've looked at that incentive model, understanding what key success metrics you might want to align the field with. So, regardless of what's in place currently, what do we think that it should be? And then it's really just setting up program dashboards to help monitor field engagement and help to unstick things along that path so that they can be successful. I think the other thing that we don't necessarily call out here on the slide is, we're talking about aligning incentives, internally to your team. But I think that there is also understanding the alignment of incentives with the partners that you're working with and with your channel strategy, and working with a partner who's going to be focused on driving coverage for your scripts and ensuring that they are, not hitting your uncovered coupon and those sorts of things, and doing the right thing for getting patients on therapy at the lowest possible price, while also doing what is going to be, beneficial to your brand outcomes as well.
Yeah, absolutely. And as with all of the other pieces that we talked about, just building in flexibility, right?
Yeah.
Things change, and building in a model and making sure your team is aware of what are trigger points for change. It just helps with the message of when we need to change our incentive model, what that looks like, and the expectation in the field.
Yeah, absolutely. So we have a number of questions that are coming in right now, and I think that I am going to pause and just grab a couple of them. So I think the first one is, what is your experience with the legal issues regarding field team access to patient data? And so I think that from that one, I know, Julia, you can weigh in on this one. Do you want to start? And then I have some perspective as well.
Sure, absolutely. And so, while you're building the programs and before you go live, there will be enrollment forms, or even in what I call an enrollment list kind of model, there would be um, patient signature required, or patient authorization required, to be able to provide certain people within the organization access. So making sure that all of those pieces are lined up and that the appropriate person is getting access to patient data. And so typically that is outlined with the legal team before go live, and those things are aligned ahead of time.
So yeah, 100%. So aligning that ahead of time and making sure that you have the proper consents in place with, your partner as the patient enrolls is going to be critical. From there, I think that it is also segmenting the data and making sure that you have different access strategies for different teams. So an FRM team may have access to PHI, whereas a field sales team may not. And so it's important that you have that flexibility and the kind of safeguards in place in order to make sure that the right data is only going to the right partner or the right people within your organization. There are also partners who will have ways to help support. So say it is a field sales rep who is following up on a script, ways to blind that rep to PHI while still getting the HCP the information that they need. For Phil specifically, we have thought through that scenario and have a process in place in order to make sure that HCPs can, receive a fax with the patient information in it that a field rep can't see. And actually, that gets to another question that I see in the chat right now, which is, we have a field sales team and FRMs. Do you supply different sets of data for each group? And absolutely. So we can provide the FRMs with that PHI if they are, able to access it based on the consents that your organization has in place. So we can definitely provide PHI to a FRM team and a more blinded version of data to the field reps. Okay, and then this one, actually, I don't have a good answer to, but Julia, I'm not sure if you do. Otherwise, it may be something we need to follow up on. But this person said, I am a nurse educator who crosses over into field reimbursement a lot. Is there a certification or some education that would help better qualify them or help them to work in this part of the field?
That's a great question. And there are different organizations that offer different types of certification. So, traditionally, FRMs were in the kind of buy and bill world. So, Med B or medical benefit type of roles. And so there are certifications through like AAPC, which are coding certifications so that you learn and are very skilled in coding, both HCPCS coding and CPT coding, that kind of certification. There's also case manager certifications that are available and advocate certifications that are available as well. So depending on the need for your particular product, I would say yes, there are certifications that can be helpful.
Great. So I'm going to jump back into the deck, but I just wanted to make sure there were some relevant questions that we addressed as we were going. So next, just really quickly, we have worked with a number of clients who have really successfully modernized their field organizations in order to drive really, really great outcomes for both patients and the brand while having, an excellent HCP experience. And so, we recently partnered with a specialty light brand who had been facing challenges from a gross to net perspective. So they were having trouble pulling through scripts. The scripts that they were pulling through were not being covered. They were at retail and really just struggling with utilization management hurdles, which were really harming the brand. So by utilizing a partner, they were able to one, increase the number of covered dispenses by 4x, and a lot of that was through just increasing the number of prior authorizations that were being submitted. But not only that, it was by using a pharmacy network that was able to maximize the likelihood that a that a plan was going to be within the network so that scripts had the best possible chance of being covered. But so that got them pretty far. But they were actually able to see an additional 13% increase in the number of scripts that were being covered when they launched a field team portal that provided information to the team about where scripts were stuck in the process and which prior authorizations were not being submitted that they could go help to shake loose. And then they also were able to partner with PhilRx in order to one, make sure that incentives were being aligned from a partner perspective so that we were being comped, from a covered script perspective, but then also to align incentives with their field organization to help support driving affordable access for patients. All right, so I think we have questions coming in pretty fast and furious, but I will go ahead and hand it back to Joan for the Q&A.
Fantastic. All right. So as a reminder to everyone listening, if you haven't already submitted your question, you still have time. Just use the Q&A tab on the left side of your screen, and we will get to as many as time allows. Our next question, our first question is, someone is asking, our company is in the process of revamping our incentive plans. Can you share some advice on key factors we should consider?
Yeah, I think that it goes back to one, understanding what are your goals as a brand and making sure that you are thinking through the overarching brand goals as you put together those key success metrics. So if you are a launch brand, potentially for those first 6 months, you don't have a lot of formulary coverage. So covered scripts may not be the ultimate goal from a brand perspective. It may be volume and pull through. And with that, you would want to design your comp plan in such a way that you would be incenting volume. If you are a year and a half post launch and all of a sudden you really need to start thinking about your gross to net and making sure that you are getting as many scripts covered as possible, I would be thinking about those metrics as you are putting together that comp plan. So I really do think that it starts with thinking about what are the strategic objectives of the overarching brand, and then how can you help to, align your plans in order to drive the best patient access and the best gross to net outcomes for the organization.
Julia, did you want to add to that?
I would love to, except my experience is not necessarily in incentive comps. I'm not sure that I would have anything to add to Catherine's.
Perfect. That was a fantastic answer. Our next question is, what key success metrics do you look at to determine if your field team is on track?
This one is one where I do have a little more experience. So for your key success metrics, you're really wanting to align those with the organizational success metrics. So understanding what those are, right, before launch, and defining what those KPIs are, so that they can be aligned to the rep's performance. But also making sure that the tools that the team is using, that those the data points are interconnected, whether that's through a data aggregator, an internal data team, so that you can really see the number of times that someone's interacting with an office, and are those interactions being effective? Do you see that offices that your rep is reaching out to more often, that they have a better successful journey through the patient support programs? So really aligning the data across so that you can have a good picture of what efforts are actionable and are resulting in actions that you'd like to see.
Excellent. And comparing apples to apples too.
Exactly.
What tools or resources do you recommend field teams use to provide patients with accurate and helpful education for new programs?
Yeah, so I think that this goes back to understanding who your stakeholders are and creating materials that are going to meet their individual needs. So if we're talking about HCPs, as you are creating your materials, One of the kind of most critical pieces is going to be, how do I make sure that my patient gets on therapy for the most affordable price? And putting, your access program front and center within those materials, and making it really simple for the HCP to understand how to get their patients the best price and how to go about actually getting them into the program. So one of the biggest challenges with patient access programs, with patient support services, is that they're not utilized, right? And so the materials that you're creating as a brand should make sure that those tools are being utilized. So part of that, from my humble opinion, is using a partner that's going to be easy for an HCP to interact with. So making sure that there aren't those, paper forms that they have to fill out and those sorts of things, that if they can just send the, ERX over to the hub directly, that helps to cut a lot of that unnecessary work out. But making it really clear within those materials how to access those support services, and exactly what both the HCP and the patient should experience. And I think that, really similar themes run through on the patient side. So if you are putting together a tear sheet, making sure that as part of that tear sheet, the access program is front and center, and that it's really clearly defined what they should expect and how to interact with, your hub or your various affordability programs, makes it so that they can really easily get their prescription.
Excellent.
Yeah,
Yeah.
I would just add that one of the things that I've have been able to observe from Phil is the kind of immediate feedback that can happen. Catherine was talking about, sending an ERX to a particular provider. So an example would be the ERX is sent to Phil directly, and a feedback loop where the patient almost instantaneously receives on their phone a notification that Phil is working on their script from Dr. So and so. So the patient can actually still be in the room with the doctor getting data from the hub program. And it's just, one of those things that Phil, in my experience, excels at, and why I've seen them as such a good partner.
That really does seem to be next level. And I think it ties right into the next question. Can you share an example of how you've created a feedback loop between your field team, HCPs, and patients?
Yeah, so I guess that example that I used is one, right? So receiving the e-prescription, and then the patient in near real time getting a notification on their phone saying, "We've gotten this. Click here to provide your consent and move forward." Being able to enter their payment information at that time, and just really keeping the patient's interaction to as concise and effective interactions so that they can move forward. So, not having a welcome call and then we call back and give a copay ID and then we call back, and it can be very segmented, and it can make the patient create a level of frustration because all of these things aren't being addressed at one time. So being able to address things quickly, and then also on the back end having that kind of real time notification when there is a roadblock. So there's been a PA was denied, for example, for a particular doctor, and having the field reimbursement team notified in near real time so that they can follow up to see what the reasons for denial were and how can I help an HCP work through those to potentially gain access for that patient. So those a couple of examples there.
Yeah, and
Excellent.
I would just add on to that, when it comes to closing the loop, that it's important for the HCP to know what the ultimate outcome was. And so having a mechanism in place where the HCP can actually find out, did the patient get on therapy or not, and what was their ultimate copay? And oftentimes we hear from clients that HCPs finding out that a patient got on therapy for a copay that was less than they expected helps to drive a lot of brand engagement and more scripts coming through.
Absolutely, that makes sense. All right, this looks to be our last question. So if anyone watching has a burning question, you have about a minute to get it in. This question says, let's face it, reps just want a script, whether it's one that makes the company money or not. How do I influence them to send to a certain channel like Phil?
So I think, the first thing that you need to think about is ultimately, right, we are all here in order to get patients on therapy and to get them on therapy for the best product, the best product for their condition and the best possible price. And so I think that, again, when you talk about incentive alignment, one of the ways to help to drive engagement with a channel that is going to be effective for your brand is to make it the one that's going to be the best price for your patients. And so we do see asymmetric copays where if there is a preferred channel, you offer patients a lower price for that particular channel. And so having copays that drive the behavior that you want, I think is a really good way to make sure that, again, as we talk about incentive alignment, that we are, putting money where our mouths are and making the best access experience for patients, the one that you want them to use.
All right, thank you. That concludes our Q&A, and thank you to Catherine and Julia for some really fantastic information and kind of a next level vision of how things will be working, can be working. And thank you to everyone here for attending this Fierce Biotech webinar and for submitting so many fantastic questions. Thank you to Phil Incorporated for presenting today's webinar. And you will have access to a recorded version of what we saw here today within 24 hours using the exact same audience link that was sent to you earlier. You'll also get an email reminder once it's ready for replay. Thank you again for joining, and we look forward to seeing you at future events.